Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, my name is Stephen Schaefer, and today I have the distinct pleasure of introducing you to our podcast's second interview with Dr. Orna Fennelly. Dr. Fennelly, a physiotherapist with PhD and postdoctoral training, currently works at the National University of Ireland, Galway, and was formerly with University College Dublin. Of note, Dr. Fennelly joined us earlier this year in April for a similar conversation that occurred during episode 39. That conversation, which was conducted by Dr. MacPherson, covered a manuscript titled Advanced Musculoskeletal Physiotherapy Practice, The Patient Journey and Experience. Today, Dr. MacPherson will again interview Dr. Fennelly on a similar topic, but this conversation is going to revolve around a manuscript titled Advanced Musculoskeletal Physiotherapy Practice, Informing Education Criteria. The last time these two met up to have a discussion about a topic, the conversation was both informative and entertaining. So let's see what they have to teach us today.
Well, Dr. Fennelly, it's great to have you back on the podcast. You're doing something right, and you're doing something that's interesting to our listeners. And let's start off with the project, if you don't mind. Do you mind just kind of giving us a brief synopsis of this manuscript and the results you came to?
Yeah, and hi Kevin, it's great to be on again, and it's great that the topic is of such interest to people as well, and that it's useful. So this project, as I would have said in the previous podcast, I did my PhD around advanced practice physiotherapy in orthopedics and rheumatology, mainly focused on the Irish service. So having completed my PhD looking at the service outcomes, the patient experience, which we spoke about the last time, the next kind of step was really looking at the education and the competencies of these advanced practice physiotherapists. So in Ireland and in many other countries where advanced practice physiotherapy is an operation, it is generally to be on an ad hoc basis. So the need of the service is really what drove the implementation of these roles. So in Ireland, it was a lot of focus on the long waiting list for orthopedics and rheumatology. And these advanced practice roles started working with consultants in orthopedics and rheumatology and started seeing the patients who were deemed on the triage of their referral letter to likely not need to be seen by a doctor, that they might not need surgery. So the issue with this in Ireland and across other countries is that without any formal accreditation or demonstration of what education they have and how they've been trained informally by the consultant, is that it's very hard to demonstrate transferability of skills and to also get remuneration for these roles and to have formal recognition of them. So that's been a huge issue for us in Ireland, in that although we have physiotherapists operating at this level of practice, they are remunerated and seen as clinical specialist physiotherapists as opposed to this new role that they're completing. And there's kind of other issues as well in terms of building the trust of the public and being able to demonstrate that these physiotherapists have those skills. So this is really what led on to this particular study, in that what competency frameworks are out there for advanced practice physiotherapists, and what education internationally is being provided to these physiotherapists, because as I said, it's not just an issue in Ireland. And then we want to look specifically at what are the education needs of the physiotherapists already working in these advanced practice roles, because they did tell us in a previous study that the lack of formal education was an issue for them, the lack of kind of consistent and standardized education, so that every physiotherapist was receiving the same level of formal support from their consultant, because obviously this will vary when you're working with different people across different hospitals. So we began looking at kind of reviewing the international literature around education for advanced practice physiotherapists. And we looked at the different competency frameworks around, especially the countries where advanced practice has really developed. So the UK, Australia, and Canada. And then we looked at what education programs were out there as well, which were specifically for advanced practice physiotherapy. So obviously there are loads of other education programs, And even in Ireland, a lot of the physios who are operating these roles have completed masters, but they weren't masters specifically for this level of practice. And then the big results, I suppose, that came out of this were that although there are obviously different physios that are operating under different jurisdictions, different scopes of practice, there were common themes across these competency frameworks and education programs regarding the roles. So around areas of the clinical skills, communication, professional related matters, kind of research and evidence-based practice, leadership and service management, and kind of the assessment skills. And having looked at the competency frameworks, then we looked kind of more specifically at the education programs. And we noticed that when we were looking at the clinical physiotherapy skills, within the education programs, there were other areas such as injection therapy that kind of fell underneath this, pharmacology, and then more the kind of more traditional, what we see as more traditional physiotherapy skills. And then under the kind of assessment that we saw in the competency frameworks within the education programs, they were also including the area of radiology, which would be considered part of the assessment, and then the assessment and diagnosis. So we also then did a survey with the physiotherapists in Ireland, and some interesting findings came from that as well about what their learning needs were. So a big one for them was radiology, actually, and pharmacology, which were kind of new areas. And we kind of deemed from that the reason that they were of interest for them was because a lot of them have already done masters, musculoskeletal masters, but they do still feel that the knowledge around pharmacology and radiology is really important. So that gave us an idea about what are the learning needs for Ireland. And we also could see what internationally, what competencies are deemed important, and also what education is currently being provided in the types of curricula out there.
So given that we are talking about these advanced practitioner, advanced practice physios, were you at all surprised that some of the survey results of the Irish practitioners came back with an emphasis on these roles or these competencies that would not be considered traditional physio?
Yeah, I think that was a really interesting finding that we found from that survey. And it was kind of like brought about a lot of discussions because we were surprised that some of the I suppose what I referred to in the paper as kind of the traditional physiotherapy skills, such as exercise prescription and manual therapy, they were not deemed as high priority for education, as a learning priority for an education program for advanced practice physios, whereas radiology, which from the previous research that I've done in these services in Ireland, it is and also kind of Niall O'Mahony has done a lot of research in this area as well and published on it. The ordering and interpreting of radiological imaging has been an important part of this role, and it is something that these physiotherapists haven't been trained in previously. So I suppose I was surprised initially, but then I wasn't as surprised that, yes, this is an important learning priority for them because they feel it's lacking from their undergraduate or other master's programs because it's not a role that is currently legislated for in Ireland. So I think that is why it hasn't previously maybe been included in programs, education programs. So it is something maybe that they're prioritizing, which was quite interesting. I think although at the moment in Ireland, as I said, it's kind of a fight that we're on at the moment, and I think I referred to it in the last podcast too, is that these physiotherapists cannot directly order the imaging. So they have to go to a consultant or another doctor to explain to them who needs the imaging and why, and then get that order done, whereas it's quite an inefficient process. So I do think that physiotherapists see diagnostic imaging as an important part of this role, as well as their other assessment skills.
So one of the research tools. So we're going to ask you to put on your researcher hat and give us kind of an understanding of what type of research was done here. You indicate that you did a scoping review, and I know a lot of our listeners will be more familiar with a systematic review. Do you mind just kind of explaining what that scoping review is?
Yeah, no problem. So really, a scoping review aims to map the research. And then when we're comparing that to a systematic review will look at essentially the effectiveness of a specific treatment. So for a study like this that we did, we were looking to see what was out there and what type of competencies and what type of modules were included, as opposed to looking at how effective or comprehensive those modules were. So that's where I suppose it differs specifically. And actually, I've been quite fortunate to be working with Andrea Trico, who has published quite a lot on the scoping reviews and rapid reviews. And I'm currently doing another scoping review with her, it's great. And there's so much more you can learn around evidence synthesis. But I suppose another kind of a very clear example as well for the listeners maybe who aren't fully familiar with the difference between a scoping review and a systematic review. At the moment, we're looking at the use of machine learning in healthcare. So rather than looking at how effective the use of machine learning applications are in healthcare, which you may use a systematic review for, we're doing a scoping review. So we're looking at where machine learning is being used in healthcare. So I suppose that's the difference. So when you're looking at what is out there as opposed to the effectiveness, a scoping review can be extremely helpful. And that's really what we did for this particular study.
Looking at the composition of the different countries involved with your study, or at least where you got a lot of the information for your scoping review, there are a lot that are Commonwealth countries, or at least have a very close approximation to them. Likely they have very similar healthcare systems. If the goal of your project is to potentially influence international standards for advanced practice physios, might there be some difficulty in translating your findings to other healthcare systems in countries that are different than the ones surveyed or you found information for?
Okay, I think that's a really interesting point. And I suppose the reason behind choosing specific countries to do this review on was in regard to how the advanced practice physiotherapy role has been well established in those countries and developed. And these are the countries where these competency frameworks have been developed. And I suppose I was quite familiar with the literature around this area, but that's not to say that there aren't other countries who are really progressing in this area. And at the WCPT conference last year, I was actually speaking to physiotherapists in Switzerland and different countries where they were very interested in what type of competency frameworks, because they're all developing similar roles. So I do think that, yes, this paper did focus on those specific countries, and really it's only a stepping stone. So looking at the countries where the roles are quite well established, what have they created in terms of competencies, what type of education programs are they providing, and then using this now to inform on a more international level, what competencies do we need to see in a more consistent and standardized advanced practice title and advanced practice competencies. So that's really what the purpose of this review is, just to highlight what is out there in those countries that have well-established roles. But there will obviously be considerations of specific countries. So obviously, like in the UK, unlike in Ireland, they have prescription rights and they also have rights to order diagnostic imaging, which we do not have. So that creates, and I highlighted this in the paper as well, it makes it challenging to have very specific competencies if we were to do an international, and this is, I'm just talking hypothetically. Obviously, this paper doesn't give concrete decisions on which competencies should be included, just says what's out there at the moment. But I think that it would make it quite challenging. And that's why I think the overall competencies would probably have to be quite broad, because we need to think about all the different countries who maybe kind of an advanced level of practice in one country, maybe a more standard level in another country. So there would have to be kind of types of clauses in these competencies, in that if we were talking about, let's say, the assessment and diagnostic skills of an advanced practice as an international competency, in some countries they may also be able to order diagnostic imaging. In another country they may just be interpreting it. So I suppose that's why it's important that you're putting in a clause that if within your own jurisdictional scope of practice. But I do think, again, obviously this review was only focused on specific countries. who have quite similar health systems, similar roles of physiotherapists. So really it is just a stepping stone. And then we need to look in the US, what is the role looking at there, what is needed. And I think even at the end of the day, even with a more consistent and standardized competencies and definition of advanced practice internationally, we will still have differences because different countries have different needs, and that will keep changing. And we're seeing it right now with the global pandemic, what countries need and how physiotherapists and other healthcare professionals have to adapt to meet that. So it is going to be a constantly evolving role, I feel, and maybe in another 20 years we'll have some other kind of role for physiotherapists. So I think with an international standard, we have to take in the international practices of physios, the scope of practice, so that the final competencies can be applied internationally, not just focusing on these specific countries.
That's a wonderful response. And I will openly admit, when I first read the paper, I was kind of just like, well, that's wonderful. It's grand expectation. But in the United States, we're not allowed to do a lot of the things that are described. So I was thinking along the lines of your potential international criteria or curricular design doesn't fit us in the normal, like, I'm going to buck the system way. However, your response just now triggered just that reminder that we have an international standard for orthopedic manual physical therapy that's developed by IFOMT, the parent organization for AOMT at the international level. And one of the things in there is certain types of manual therapy, or discuss for certain types of manual therapy, of which thrust manipulation is one, in which in the United States, there are different states that therapists are not able to do that, yet there are criteria available. So you even make mention that IFOMT is a potential group to maybe model a international curricula from. So thank you for getting me thinking about that to a deeper level. So in follow-up to your manuscript here, in looking specifically at Cuff et al., they kind of had some worry that was expressed with the findings from the survey that was provided to the Irish physios. It seemed like there might have been this worry that focusing on competencies such as radiology and pharmacology might result in overutilization of those different modalities that we know that there is evidence might, if not maybe not change the trajectory of the patient at all, or potentially result in poorer outcomes if you use them. What was your response to that potential overutilization if we focus on those more physician-centric competencies?
Yeah, it was quite an interesting response letter to the paper. And it was interesting that, I suppose, they chose to focus on that priority, that learning priority of the Irish physiotherapists. So I suppose, first of all, you have to look at the paper overall, and there is quite a lot in it. And I suppose we were looking at the competency frameworks and the education programs, but then we were looking specifically at what are the learning priorities of Irish physiotherapists who are either operating or hope to operate at an advanced practice level. And for them, radiology is a key learning priority, and it was the most prioritized of the learning priorities. So I suppose this paper picked up on us focusing more on radiology as part of this role, when in fact it's actually just a learning priority. And I would not agree that educating the physiotherapists operating at the advanced practice level will result in over ordering and over prescription of imaging. In fact, I would argue that really educating physiotherapists in interpreting and the correct and evidence-based use of imaging when it is actually required and when it would be helpful would actually reduce further the way imaging is used. And there is evidence supporting that the physiotherapists either order the same or in fact less imaging than their medical colleagues. So I suppose that really is my response. I do think there's a place for radiology, but I do agree that we definitely don't want to be moving towards the over medicalization of, and this role still the most important aspects, and even from that patient's experience, is that the clinical skills that these physiotherapists have, if they can use imaging where it's required, and if they're educated in its use, and it's in its most appropriate use, it may be a beneficial. And patients saw that as well, that they can go see one clinician and they can get the imaging if it's needed, and they trust in the clinical skills of this physiotherapist. And there's also lots of evidence. It's great seeing there's loads of publications around the telehealth as well. And it really is physiotherapists' clinical skills and assessment skills that they really have high diagnostic accuracy without the use of imaging. So that's coming out hugely. So I do not believe including it in an education program would result in over-medicalization. But I also don't believe it should be a high or one of the top competencies. I would see it sitting more under the kind of the clinical skills and assessment skills. And that, again, as I mentioned before, that it would, like, the ordering and interpreting of radiological imaging, the use of pharmacology, I suppose, and the understanding of it, the use of and the ordering of laboratory investigations, all of those may have a place in this role, but they come with a clause in terms of your jurisdictional abilities, the legislation. They may be part of the role, but they are not the main focus. And I think it became a bit of a focus of that particular response paper, even though really this paper is highlighting that it is included in some education programs, the use of radiology, which I do agree with, but it is not a main competency of this role.
And that's kind of, I too was a little bit not expecting the viewpoint of that author or that group of authors, because I just think that in general, I would say that physiotherapy has done a really good job as a profession worldwide to embrace the biopsychosocial model and to really focus on, especially and specifically in relationship to pain, that it is much more complex than what an image could provide. So when I saw that response, I said, well, that doesn't really fit my experience with physios in the US. But at the same time, being very well aware of our now larger push as a profession in the US to try to institute physio inside of the it's A&E for you guys, I believe, but inside of our emergency departments in the US, that, you know, if somebody comes in and they're positive on the Ottawa ankle rules, that's not a time to really defend not using radiology. Like that is the time where you say, no, this person fits a rule that says you should use it. But I also see that physios do take that tact of, well, you have non-specific low back pain of non-traumatic order, I'm not going to order an MRI.
Yes, and I don't think that including radiology and the ordering and interpreting of radiology in an education program will change that. And I'd hope not. And maybe it is important that it was highlighted within that response paper in case that is a concern of physiotherapists. But I don't think that will happen.
I agree. Now, you kind of alluded to it a little bit here. So I'm going to put you now in the curriculum designer seat. Were you to create an advanced practice model, and let's isolate it a little bit. Let's stick with orthopedics. What would that curriculum look like from a emphasis and maybe a duration, and then finally like the supervision model? What would those three aspects look like?
I think that in developing an education program for advanced practice, I do think it would be very dependent on the local context, the needs of the physiotherapists, what, I suppose, level of education they already have. So, for example, in Ireland, those physiotherapists working at advanced level of practice, majority of them have already completed a musculoskeletal master's. So I do think it's important that they would be able to demonstrate their prior learning. So I would see that potentially the advanced practice program may not necessarily be a master's level. It may be in some countries that may be appropriate, but potentially in Ireland that it would be types of diplomas to be able to complete masters or able to complete modules, at appropriate times. But I do think definitely the experiential and working directly with the consultant would remain, and I think would be still the extremely important part. And I think there's a lot of literature to support that as well, the important aspect of actually getting the clinical experience. So I do think those would be two important parts of the curriculum overall. All is that mentorship, and then obviously, especially in Ireland now, this is maybe more of an Irish context. I'm not sure what it's like in the US, but in terms of supporting those physiotherapists who are undertaking additional education to benefit the health service, I do think there has to be support in terms of funding and the management. So there are things that we've already been discussing in Ireland, which will be extremely important when developing this university program as well, is that the funding and the support is there for the physiotherapists, and they're not, because often they are paying for their own masters themselves. In terms of the duration, then I would imagine that if these physiotherapists are keeping up some of their clinical load, it would not necessarily, I know some of the masters that I identified in the literature review were 2 years long, whereas it would depend how many modules they were completing and at one time, how much of a clinical load they have on the side. So, and then I suppose, I think you mentioned as well, what I suppose maybe the emphasis or the themes that would be included in the type of education program. So again, the reason we did the survey of the physiotherapists in Ireland was because we wanted to identify what the specific learning priorities were, and for them, radiology came out quite high. So, but I don't necessarily. That's one area that maybe they feel they need to be focusing on. What I would really see as extremely important are the clinical skills in general. And I do think communication comes in to that as well. I suppose none of these are completely independent either. So I do think the communication and the shared decision making and that ability is extremely important for advanced practice physiotherapists, because the patients really, when they see them, they're trusting in them, and it's the confidence and the clinical decision making of that physiotherapist that they will listen to. And so that's kind of touching back on that imaging. I think that is a key part of what physiotherapists offer, as well as educating physiotherapists or patients on when they need clinical imaging, when they may need surgery, or what other options are out there. So I think that is a huge part of it. And then what I would see as well is the leadership and service management as being quite important in these roles. I know that in Ireland, a lot of these physiotherapists have had to advocate for their roles. They've been developing the services. I know that has been the situation kind of previously. It's much more established in the UK at this point, but initially that's the way it would have been. Same with Australia, from speaking to advanced practice physios there, that the service management and development wasn't an important part. And I think it's maybe something that isn't included in an entry-level program. It's, I suppose, when you physiotherapists get experience and then getting that additional education around leadership and advocating and speaking to the consultants, being able to just all that side of it.
In general, the process that you've described is very similar to fellowship in the United States for the American Academy of Orthopedic Manual Physical Therapists. Obviously, in this case, it would focus more on that advanced practice in both Ireland and the other countries, but what we would likely more term as a physician extender role, which means that it makes more sense that you had that connection between IFOMT as a potential model for a group that would monitor and create a set of competencies at the international level. So Orna, I've really enjoyed the discussion. I've really enjoyed getting a better feel for all of the work you're doing around the advanced practice model or framework, or trying to really enhance what that really looks like. So it's a little bit less, for lack of a colloquial term, hodgepodge. What else might you be working on? I know you said you're working on a scoping review. Or another scoping review. Can you give us some insight on what's going on in your research world right now?
Yeah, I suppose I've remained kind of working in the advanced practice side. I've moved. As you mentioned, I work in the Irish Centre for High-End Computing now, so I've moved more into the data side of things. Mm-hmm. But a paper has just been published by the team at UCD by Maria Moore around the physicians' perspectives of this advanced practice role in pediatrics. So it's great to still be involved, because it's something if you're spending 5 years of your life researching advanced practice and advocating for it, I don't think it's ever something that I will fully separate from. But in terms of, I suppose, what my usual day job is, at the moment I'm working, yes, as I said, I'm working with Andrea Trico in the University of Toronto and her team there. So yeah, we're looking at the use of machine learning in healthcare. And that's as part of a fellowship that I'm doing with Evidence Synthesis Ireland. It's kind of a mentorship program. Again, as I said, the areas of evidence synthesis, I think we're seeing it, especially during this pandemic, the importance of it and rapid review. So that's been really interesting. And then the project then that I'm working on at iTech, I'm looking at the use of data in Ireland and health data and the ability to link data for purposes of research. So we're developing kind of an infrastructure. So a lot of my work at the moment, I'm not developing the infrastructure. Fortunately, I'm working with some great computer scientists that are doing that side of it. But I'm reviewing kind of, again, a similar idea in that I'm reviewing what's international best practice in terms of the combination of health data from hospitals, from national health data sets, from GP systems, and looking at that to help inform what we should do in Ireland. So although it's a completely different area, it's actually quite similar in terms of, this is the area I'm working on in terms of looking at what is being done internationally and then bringing it together in order to inform what we could do in Ireland within our local context. And our, I suppose, again, the legislation, different types of health services, all that influences how we develop this infrastructure. So that's kind of really the area that I'm moving into now, and kind of the use of electronic health records then as well. I have a paper under review at the moment. So it's all very exciting.
Yes, I mean, you're definitely a data cruncher at the pinnacle term, and we look forward to seeing all the work that you're putting out to improve, likely not just healthcare systems within Ireland, but also to build that research body that might help out all of the different countries as they both transition to better electronic or universal electronic health documentation systems to improve outcomes for patients. So, Orna, I'm sure you're going to have one or two people who are interested in following up with you, and I say that more because of our listenership. So we're hoping to get more people referring their friends to listen to us. But what's the best way that somebody might be able to contact you if they had some follow-up questions?
Yeah, I'd be very happy to discuss this further, and even people have any feedback or comments regarding education of advanced practice physios or any of the work that I'm doing at the moment around health data linkage. But feel free to contact me on Twitter at Orna Fennelly, so it's ORNA FENNELLY, or by email. So I regularly check my UCD Connect email, which is on my publication. So it's orna.fennelly at ucdconnect.ie. But I'm usually quite easy to find. You can find me on ResearchGate or Orna Fennelly as well. So please feel free to get in contact.
And if you can't find her there, you can find her on the Camogie.
Camogie, yes.
So
that's it.
Definitely keep an eye out for the stick and don't get hit if she's charging at you. Well, thank you very much, and I hope you have a wonderful rest of your day, Dr. Fennelly.
Thank you very much, Kevin.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at aaompt.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.